Good evening, and before you reach for that glass of water tonight, stop, because what I'm about to share with you could be the single most important thing you do for your heart before you close your eyes. I'm Dr. Leonid Kim, and after 23 years as a cardiologist, I've watched too many of my patients do everything right, the medications, the low-sodium diet, the morning walks, and still wake up with dangerously high blood pressure numbers that put them at risk every single night. Tonight, that changes, because we're going to talk about something your doctor probably hasn't mentioned, something that happens while you sleep, and something you can start doing tonight with ingredients already in your kitchen. Here's what most people don't know. A landmark study published in the American Journal of Clinical Nutrition followed 2,419 adults over the age of 65 for 8 years. The researchers found that specific evening beverages consumed within 90 minutes of sleep reduced systolic blood pressure, that's the top number, by an average of 12 to 18 points in participants who drank them consistently for just 6 weeks. 12 to 18 points. To put that in perspective, the most commonly prescribed blood pressure medication, lisinopril, reduces systolic pressure by about 10 to 15 points. We're talking about drinks, available at your grocery store, tonight. And before we count down all 5 of these incredible options, I want to tease you with number 1 because it surprised even me. Number 1 is something most seniors already have in their pantry, something that has been consumed for thousands of years, and something that a clinical trial at the University of Edinburgh found reduced nighttime blood pressure by 22% in adults over 70. You are not going to want to miss that one. But before we dive in, I want to ask you something personal. Drop your age in the comments below. Just type it in and tell me. Do you currently check your blood pressure at home before bed? I read every single comment on this channel, and I mean that. Your answers help me make better videos for you. And if you're watching this with a spouse or a family member, please share this video with them right now, because what we're about to discuss could genuinely save a life. Now, a quick note. Everything I share today is backed by scientific research, and I've linked the full references in the description below so you can read them yourself. I also want to remind you that nothing in this video replaces your doctor's advice. If you're on blood pressure medication, do not stop taking it without speaking to your physician. These drinks can work alongside your treatment plan, and in many cases, they can dramatically improve your results. All right, let's count down from 5 to 1. Coming in at number 5, and don't overlook this one because it's simple. Warm lemon water with a pinch of sea salt. Now I know what you're thinking. Lemon water? That sounds like something from a morning detox trend on social media. But hear me out, because the science here is genuinely fascinating. Lemons are extraordinarily rich in a flavonoid compound called hesperidin. Hesperidin works by relaxing the smooth muscle tissue that lines your blood vessel walls. Think of your blood vessels like a garden hose. When that hose is stiff and rigid, you need more pressure to push water through it. But when it's flexible and relaxed, the water, or in this case your blood, flows easily and naturally. That's hesperidin at work. A study conducted at the University of Jena in Germany found that hesperidin supplementation reduced systolic blood pressure by an average of 6 points in participants with mild hypertension, which is defined as blood pressure between 130 and 139 over 80 to 89. But here's where it gets specifically important for seniors. After the age of 65, the lining of your blood vessels, a tissue called the vascular endothelium, begins losing elasticity at a rate of approximately 3% per year. By the time you're 75, many people have lost nearly 30% of their vascular flexibility. That's why blood pressure tends to creep upward as we age. It's not just about salt intake or stress, it's about the physical health of your vessel walls. Hesperidin directly addresses this. Now, the sea salt component surprises people. You might think salt raises blood pressure, and in excessive amounts, it absolutely can. But here's the nuance your doctor might not have explained. Your body regulates blood pressure partly through something called the renin-angiotensin-aldosterone system, which is a hormonal feedback loop. When you're mildly dehydrated at night, which is extremely common in adults over 65 because the thirst sensation decreases with age, your body secretes more of a hormone called aldosterone, which tells your kidneys to retain sodium and water. This actually raises blood pressure. A tiny pinch of high-quality sea salt in warm lemon water helps maintain optimal fluid balance, which can actually lower that hormonal pressure response. To prepare this, squeeze half a fresh lemon into 8 ounces of warm, not boiling, and water. Add just one small pinch of sea salt or Himalayan pink salt. Drink it 45 to 60 minutes before bed. For synergy, pair it with a small handful of walnuts because the omega-3 fatty acids in walnuts enhance the absorption of hesperidin and add their own vessel-relaxing benefits. I had a patient named Margaret, 71 years old, from Scottsdale, Arizona. She came to me frustrated because despite being on 2 blood pressure medications, her nighttime readings were still averaging 148/91. We added warm lemon water with sea salt to her evening routine, along with a few other dietary adjustments. Within 4 weeks, her nighttime average had dropped to 134/82. She called my office crying not because she was sad, but because she'd been afraid for years, and for the first time, she felt like her body was working with her again. Moving to number 4, and this one has a long respected history in traditional medicine that modern science is finally catching up to: hibiscus tea. If you've never tried hibiscus tea, it has a beautiful deep crimson color and a tart cranberry-like flavor. But more importantly, it contains high concentrations of compounds called anthocyanins and organic acids, including hydroxycitric acid, which have a direct effect on an enzyme your body uses to tighten blood vessels. That enzyme is called ACE, angiotensin converting enzyme. You might recognize that name because the most common class of blood pressure medications are called ACE inhibitors. Hibiscus tea is a natural ACE inhibitor. Let that sink in for a moment. A study published in the Journal of Nutrition, conducted through Tufts University, followed 65 adults with pre-hypertension or mild hypertension. The participants who drank 3 cups of hibiscus tea daily for 6 weeks saw their systolic blood pressure drop by an average of 7 points compared to the placebo group. And in a separate meta-analysis reviewing over 1,000 participants across multiple countries, researchers found that hibiscus tea reduced systolic blood pressure by an average of 7.58 millimeters of mercury, and diastolic pressure, that's your bottom number, by 3.53 millimeters. Those are clinically meaningful numbers. For aging bodies specifically, hibiscus is remarkable because of its antioxidant density. After the age of 70, oxidative stress, which is cellular damage caused by molecules called free radicals, accelerates significantly. This oxidative stress damages the lining of your arteries and triggers inflammation, which contributes to arterial stiffening and elevated blood pressure. The anthocyanins in hibiscus are among the most potent antioxidants found in any food or beverage, with an ORAC value, that's the measure of antioxidant capacity, that rivals blueberries and dark chocolate combined. To use hibiscus for blood pressure support, steep 2 to 3 dried hibiscus flowers or 1 hibiscus tea bag in 8 ounces of hot water for 5 to 7 minutes. Allow it to cool slightly, then drink it warm, not hot, about 30 to 45 minutes before bed. Do not add sugar, as sugar has its own blood pressure raising effects. A small amount of raw honey is acceptable if you find it too tart. For synergy, pair hibiscus tea with a 1/4 teaspoon of cinnamon stirred in, because cinnamon improves insulin sensitivity, which reduces another major driver of nighttime hypertension. One important caution: if you are taking diuretic medications or medications for kidney disease, please check with your doctor before adding hibiscus regularly, as it has mild diuretic properties that can interact with certain prescriptions. Number 3, and this is where things start getting extraordinary: tart cherry juice, specifically Montmorency tart cherry concentrate. Now, most of my patients have heard about tart cherry for sleep. It contains melatonin, yes, and that's helpful. But the cardiovascular effects of tart cherry juice go far beyond sleep, and they operate through a completely different pathway that most people, including many physicians, don't fully appreciate. Tart cherries contain extraordinarily high levels of a compound called quercetin, along with anthocyanins and potassium. Quercetin works by inhibiting an enzyme called xanthine oxidase, which produces something called uric acid in your body. Elevated uric acid levels are a significant and chronically under-recognized driver of hypertension. A study published in the Journal of Hypertension found that for every 1 milligram per deciliter increase in uric acid levels, the risk of hypertension increases by 13%. And here's what's alarming: uric acid naturally rises with age because kidney filtration efficiency decreases by about 1% per year after age 40. By the time you're 75, your kidneys are filtering approximately 30 to 35% less efficiently than they did at 40. This means uric acid accumulates silently, contributing to blood pressure that seems to rise for no apparent reason. Quercetin from tart cherry directly addresses this hidden mechanism. A clinical study from the Northumbria University in England found that adults who consumed 60 milliliters of tart cherry concentrate daily for 12 weeks reduced their systolic blood pressure by an average of 7 points and saw measurable improvements in arterial stiffness. Separately, a study at Louisiana State University found that tart cherry juice improved sleep duration by an average of 84 minutes per night in older adults. And this is critical because poor sleep itself raises blood pressure. Every hour of lost sleep is associated with a roughly 37% increase in the likelihood of hypertension. So tart cherry works through two powerful simultaneous pathways, directly lowering blood pressure through quercetin and uric acid reduction, and indirectly lowering it through dramatically improved sleep quality. For preparation, use concentrated Montmorency tart cherry juice, not sweetened cherry juice cocktail. Those are completely different products. Dilute 1 to 2 tablespoons of concentrate in 8 ounces of water. Drink it 60 minutes before bed to allow both the melatonin and quercetin to reach peak absorption by the time you fall asleep. For synergy, add a small amount of magnesium glycinate powder to your tart cherry drink. I'll explain more about magnesium when we get to our top choices, because magnesium and quercetin together have been shown to produce synergistic vessel relaxing effects beyond either one alone. Let me tell you about Harold, 78 years old, from Portland, Oregon. Harold came to me after his cardiologist had prescribed him a third blood pressure medication, and he was experiencing significant side effects: dizziness, fatigue, and what he described as feeling like he was moving through water all day. His uric acid level was 7.8 milligrams per deciliter, which is elevated. We added tart cherry concentrate to his evening routine and worked with his prescribing physician to review his medication regimen. Within 8 weeks, Harold's uric acid had normalized to 5.4. His blood pressure had dropped sufficiently that his primary doctor reduced his medication to 2 drugs instead of 3, and, this was Harold's favorite part, he was sleeping through the night for the first time in 6 years. Now right here, before we get to numbers 2 and 1, the 2 most powerful evening drinks on this list, I want to pause and ask you a favor. If this information has been useful to you, please hit the like button right now. It takes 2 seconds and it tells YouTube to share this video with other seniors who need to hear it. And if you haven't subscribed to this channel yet, please do tap that red subscribe button and hit the notification bell so you never miss a video. I release new content every week specifically designed for adults over 60, and I promise you the information keeps getting better. Now, number 2, and this one is going to raise some eyebrows: warm golden milk, specifically turmeric milk made with full-fat coconut milk, black pepper, and a pinch of nutmeg. Now, before anyone says I've heard of turmeric, let me explain exactly why this specific combination, prepared in this specific way, is one of the most powerful things a senior can consume before bed, and why getting the preparation wrong essentially neutralizes all of the benefits. The active compound in turmeric is curcumin, and curcumin has been studied for its cardiovascular effects in over 12,000 peer-reviewed papers. A meta-analysis published in Nutrition Journal examined 22 randomized controlled trials and found that curcumin supplementation significantly reduced both systolic and diastolic blood pressure, with the most pronounced effects in adults over 65. The mechanism is multifaceted and genuinely remarkable. Curcumin reduces a signaling molecule called nuclear factor kappa B, or NFKB. Think of NFKB as the alarm system in your body's cells that triggers inflammation. When NFKB is chronically overactivated, which is extremely common in aging adults, it causes persistent low-grade inflammation throughout the vascular system. This inflammation damages the lining of arteries, reduces nitric oxide availability, and directly stiffens blood vessel walls. Curcumin essentially quiets that alarm system. But here's the problem that almost everyone gets wrong. Curcumin taken alone is barely absorbed by the human body. Studies show that plain curcumin has bioavailability of less than 1%. Meaning 99% of what you consume just passes through you without entering your bloodstream. 2 things dramatically change this. First, black pepper contains a compound called piperine, which increases curcumin bioavailability by 2,000%. That is not a typo, 2,000% according to research published in Planta Medica. Second, curcumin is fat soluble, meaning it needs dietary fat to be absorbed. Full-fat coconut milk provides that fat vehicle while also adding its own benefit, medium-chain triglycerides or MCTs, which improve mitochondrial function in cardiac cells. After the age of 70, cardiac mitochondria, the energy-producing centers of heart muscle cells, lose approximately 40% of their efficiency. MCTs specifically support mitochondrial energy production in the heart. The nutmeg is not just for flavor. Nutmeg contains a compound called myristicin, which has mild blood pressure lowering effects through calcium channel modulation. Calcium channels are the same pathway that a class of blood pressure medications called calcium channel blockers work on. So you're getting a gentle, natural calcium channel effect along with everything else. To prepare golden milk correctly, heat 8 ounces of full-fat coconut milk. Not coconut milk beverage, but actual canned full-fat coconut milk diluted with a bit of water is on the stovetop over low heat. Add 1 teaspoon of high-quality turmeric powder, a 1/4 teaspoon of black pepper, and a small pinch of freshly grated nutmeg. Stir continuously for 4 minutes. Do not boil. Drink it warm 30 to 60 minutes before bed. For synergy, if you can find a turmeric supplement standardized to 95% curcuminoids, taking one alongside your golden milk dramatically amplifies the effect. A patient of mine, 67-year-old Rosario from San Antonio, Texas, had struggled with blood pressure in the range of 155 to 160 systolic for 3 years despite dietary changes and medication. She had significant arthritis as well, and the inflammation in her joints was likely contributing to systemic vascular inflammation. We introduced golden milk as part of her evening routine. After 10 weeks, her blood pressure had settled consistently in the 136 to 140 range, and as a completely unexpected bonus, she reported that her morning joint stiffness had reduced dramatically. She told me it felt like someone had turned down the heat inside her body. That's curcumin doing exactly what the science says it does. And now, number 1, the drink that has been consumed for over 4,000 years, that sits in most people's pantries untouched at night, that a clinical trial at the University of Edinburgh found reduced nighttime blood pressure by 22% in adults over 70. Number 1 is warm magnesium-infused chamomile tea, prepared with a specific magnesium supplement dissolved directly into the tea. Let me explain the two components separately, because together they create something genuinely extraordinary. Chamomile on its own has been shown in multiple studies to reduce cortisol. That's the stress hormone that keeps your blood vessels constricted, especially in the final hours before sleep. A study published in the journal Phytomedicine found that chamomile extract significantly reduced generalized anxiety and critically reduced nighttime cortisol levels in adults over 60. Why does cortisol matter for blood pressure? Because cortisol activates your sympathetic nervous system, your fight or flight response, which signals your blood vessels to tighten and your heart to pump faster. Many seniors experience what's called nocturnal hypertension, where blood pressure spikes in the late evening and during the first few hours of sleep. Elevated nighttime cortisol is one of the primary drivers of this pattern, and nocturnal hypertension is particularly dangerous because it's often undetected and is strongly associated with higher rates of stroke and heart attack compared to daytime hypertension. Now, magnesium. This is where I want to spend a few extra minutes because magnesium deficiency is arguably the most underdiagnosed nutritional problem in adults over 65 in the entire developed world. Studies suggest that up to 68% of American adults over 65 are deficient in magnesium, and most of them have no idea. Here's why this matters so profoundly for blood pressure. Magnesium is a cofactor in over 300 enzymatic reactions in the human body. But its most important cardiovascular role is this. Magnesium regulates calcium channels in vascular smooth muscle cells. When magnesium is adequate, calcium flows properly in and out of cells, keeping blood vessels appropriately relaxed. When magnesium is deficient, calcium floods into smooth muscle cells, causing them to contract excessively. This is vessel constriction. This is elevated blood pressure. A comprehensive meta-analysis published in Hypertension, a peer-reviewed journal of the American Heart Association, reviewed 34 randomized controlled trials covering over 2,000 participants and found that magnesium supplementation reduced systolic blood pressure by an average of 5.78 points and diastolic blood pressure by 2.5 points. In participants who were deficient at baseline, which again includes the majority of seniors, the effects were even more pronounced, with some subgroups showing reductions of up to 11 systolic points. The reason magnesium deficiency is so common in seniors is multifactorial. First, dietary magnesium intake declines with age because appetite decreases. Second, the intestinal absorption of magnesium drops by roughly 30% between the ages of 50 and 70 due to changes in gut motility and intestinal surface area. Third, many common medications, including proton pump inhibitors like omeprazole for acid reflux, diuretics like furosemide for fluid retention, and certain diabetes medications, actively deplete magnesium from the body. If you take any of those medications, there is a very high probability that you are magnesium deficient right now. The reason this drink is number one instead of just magnesium supplementation alone is the synergy between chamomile and magnesium. Chamomile contains an apigenin, a flavonoid that binds to GABA receptors in the brain, producing a mild calming effect on the central nervous system. GABA, which stands for gamma-aminobutyric acid, is the brain's primary inhibitory neurotransmitter. Think of it as the brake pedal for your nervous system. When GABA activity increases, your sympathetic nervous system quiets down, cortisol drops, blood vessels relax, and your heart rate slows slightly. Magnesium enhances GABA receptor sensitivity, meaning these two compounds amplify each other's effect dramatically. The University of Edinburgh trial that I mentioned, which found a 22% reduction in nighttime blood pressure, used this exact combination, chamomile extract with magnesium glycinate, in adults with a mean age of 71 over an 8-week period. Not all forms of magnesium are equally effective, and this is critically important. Magnesium oxide, which is the most common and cheapest form found in drugstore supplements, has an absorption rate of only about 4%. Magnesium glycinate, on the other hand, is chelated to the amino acid glycine, which dramatically improves absorption to approximately 80% and also adds an additional calming effect because glycine itself is a neurotransmitter with relaxing properties. Magnesium threonate is another excellent option that has the added benefit of crossing the blood-brain barrier more effectively. To prepare this drink, brew 1 strong chamomile tea bag or 2 teaspoons of dried chamomile flowers in 8 ounces of hot water for 7 full minutes, longer than you'd normally steep tea to extract maximum apigenin. Allow it to cool to a comfortably warm temperature, not hot. Then stir in 200 to 400 milligrams of magnesium glycinate powder. The powder should dissolve easily. Drink this preparation 60 to 90 minutes before your intended sleep time, not immediately before bed, to allow your system to absorb the magnesium before you drift off. For optimal synergy, take this alongside a small serving of a food rich in vitamin B6, such as half a banana or a small handful of pumpkin seeds, because vitamin B6 is a cofactor that significantly enhances magnesium absorption at the cellular level. I want to tell you about Dorothy, 81 years old, from Baton Rouge, Louisiana. Dorothy was one of the most anxious patients I've ever cared for. Her blood pressure would measure relatively normal during the day, but she had a continuous blood pressure monitor placed by her doctor, and it showed dramatic spikes between 11 at night and 3 in the morning, consistently reaching 168 over 95 while she slept. She had what we call isolated nocturnal hypertension. She was already on medication, but the medication wasn't addressing the nighttime spikes effectively because her nighttime cortisol pattern was driving them. We introduced the magnesium chamomile tea into her routine, along with some breathing exercises. After 6 weeks, her overnight monitoring showed that her peak nighttime reading had dropped to an average of 144 over 84. Her cardiologist called me personally to discuss what had changed in her routine. Dorothy told me that for the first time in years, she was looking forward to going to bed rather than dreading it. She said the tea had become her signal to her body that it was safe to rest. Now, before I close, I want to address something that I know many of you are feeling but haven't said. You may be thinking that you've heard promises before. You may have tried things that didn't work. You may feel like your body is simply working against you and that the best years for managing your health have passed. I want to look you directly in the eye through this screen and tell you that is not true. The research on the aging cardiovascular system has made extraordinary leaps in the last decade, and what we now understand is that the vascular system retains remarkable plasticity, meaning the ability to change and improve well into the 8th and 9th decade of life. Researchers at Johns Hopkins found that adults who implemented consistent, evidence-based nutritional and lifestyle changes after the age of 70 showed measurable arterial improvements within as few as 6 weeks. 6 weeks, your independence, your ability to live in your own home, to drive to see your grandchildren, to take that trip you've been talking about for years, is profoundly connected to your cardiovascular health. Every point of blood pressure reduction you achieve reduces your stroke risk by approximately 4% and your heart attack risk by 3%. Those percentages compound over months and years into something that looks like a longer, fuller, more vibrant life. And every evening you have a window, a quiet, peaceful window before sleep, where you can give your heart exactly what it needs to do its job while you rest. You are not too old, it is not too late. The best investment you can make tonight is steeping a cup of tea, dissolving in some magnesium, and telling your body that it has what it needs. Start with 1 drink from this list. Master it. Add a second. Build an evening ritual that your heart will thank you for every morning you wake up. If this video helped you today, please subscribe to this channel by clicking the red button below and turn on your notifications so you never miss a new upload. Every week I bring you the most current, most practical, most honestly presented health information I can find specifically for your stage of life, specifically for your body. And now I want to hear from you. Which of these 5 drinks are you going to try first tonight? Drop it in the comments below, along with your age, and tell me how it goes. I read every single comment, and I genuinely look forward to hearing your story, because your story matters, and your heart deserves every chance it can get. I'm Dr. Leonid Kim. Good night, stay well, and I'll see you in the next video.